Hello and welcome to our panel discussion. Welcome to the LGBT People of Color Global South Summit. My name is Antoine Craigwell, and I would like to extend a hearty welcome wherever you are in the Global South. This evening, we will be looking at and talking about return to society, a post-pandemic mental health impact on LGBTQ people of color. Sharing this evening with us is Kenita Placide from St. Lucia, representing ECADE, and Midnight Ponkatisiwana, who represents APCOM in Thailand. So this evening's program is going to be, we're going to have a moment of silence in a moment. Then we're going to have, I'll tell you guys a little bit more about what the Global South Summit is. We will acknowledge our planning team members and the partnering and participating organizations. And then we'll get into our discussion with Kenita and with Midnight. So just to begin, let us take a moment in silence as we honor, remember, and invite into this summit community members we lost to homicide, suicide, HIV, AIDS, and the COVID-19 virus. Let us also remember our community members who struggle with and against domestic and intimate partner violence, and who struggle against family and community, including the LGBTQ community and states of oppression in which they live. Thank you. So what is this Global South Summit? When we consider Black and people of color living along the equator in the Global South, we consider that these are the largest population on Earth. And since LGBTQ are present in all communities, we affirm that LGBTQ people of color constitute the largest sub-demographic in the world. We are aware that when international media often report on or about LGBTQ people of color in the Global South, these often follow a tragic event. Our community's pain is often pathologized and exploited. Rarely, if ever, do we hear, see, experience our community members' richness, beauty, vibrancy, and resilience. We would like to change that image. We hope to change that image. We want LGBTQ plus people of color who live along the equator and in the Global South to be seen and heard. We want to highlight and celebrate LGBT people of color lives. Even though representatives in the diaspora created a framework for this summit in the Global North, it was imperative that community members reclaim their voice and provide a programming from their respective locales. They tell us, they show us who they are, how they live, how they celebrate, and more importantly, how they mourn. So my name is Antoine Craigwell, and I am the president and CEO of DBGM, which is an organization that was founded to raise awareness of the underlying factors contributing to depression and suicidal ideation impacting Black gay men. I've been doing work in mental health since about 2010 and formed the organization in 2013. Since forming the organization, I produced a documentary called You're Not Alone, in which Black gay men talk about their struggles and the things that contribute to their descent into depression. I've actually contributed to a number of publications, including most recently an anthology called Head Case, an anthology of LGBTQ writers and artists on mental health and wellness that was published by Oxford University Press in February 2019. And in April of 2019, provided a segment in a report, the New York State Governor's Suicide Prevention Report on considerations and context for treatment, the whole person. Together with the organization DBGM and a number of other collaborating community partners, we host, in my mind, an annual mental health LGBT people of color conference. This year is our 7th year, and we are focusing this year on youth mental wellness, resilience in uncertainty. One of our panelists for this evening's conversation is Kenita Placide, who is the founder and executive director of Eastern Caribbean Alliance for Diversity and Equality. For 2 years, she served as the Outright Action International Caribbean Advisor, and for 10 years was the executive director of United and Strong Incorporated. And for more than 14 years, she advocated for HIV and women, youth, and LGBTQI human rights issues. Intent on removing patriarchal barriers in LGBT advocacy and feminist platforms, Kenita assumed many roles to bring attention and funding to the smaller islands in the Eastern Caribbean and in international spheres. She serves on the Management Committee, Caribbean Forum for Liberation and Acceptance of Genders and Sexuality, is the Americas representative, the Commonwealth Equality Network, is the co-chair, International Advisory Board, Dignity Network, Canada, the Caribbean advisor for the Emergency Response Freedom House, Dignity for All LGBTQI Assistance Programs, and is a champion for change with PANCAP in Guyana. Community members, I'd like us to welcome Kenita. Kenita, welcome. You're on mute.
Thank you, Antoine. Thank you. And let me say a pleasant welcome to everyone here attending, those following us on Facebook, and for those of you who will follow later on. It's really an honor to be able to have this conversation, especially when we are focused on um, the issues around our people, you know. And when I say our people, we are looking at people tend to not think clearly about when we talk about persons of color, what do we mean? What do we mean about Black people? And in our region, in our heritage, we understand that we actually have different shades of brown, different shades of Black. And when we speak about global south, again, another thing that needs to be defined: who is from global south? What's the relation to that of power or element of existing? And for most of us who live in the global south, many persons around us look like ourselves, and we don't really have to think about it. ECADE actually started some 6 years ago, looking at how could we continue to build on some of the work that had started under Carry Flags. And Carry Flags was is the umbrella organization in the regional umbrella organization in this region. And we were doing work specifically in the Eastern Caribbean. Building on this, we had a consultation with people. We brought them to the table and we said, what would you like to do? This gave birth to ECADE. And with ECADE being around for the last 5 years, actually June 21st is actually our 5th-year legal registration anniversary, although we started in 2015 putting things together. And what we have seen is the growth, the visibility, the mobilizing of communities. And then the world came to a stop. The pandemic hit. What was that like for the Caribbean? I think for most persons who understand the Caribbean region, we know that there are two major things with the Caribbean. One is hit by hurricane almost every year, because that's one of the most active regions for hurricanes. But it's also a region that have tourism as their major dollar. And so when we look at the import and we look at development, it's about the tourism industry. With COVID, all tourism in the entire tourism industry actually flatlined. There was no hotels operating, no flights going in and out, or very few, should I say. Um, the cruise lines were grounded, and all industries relating to that, whether it was interior decorating, catering. You think about those persons who are the farmers who are growing their foods. You think about the impact of not having that market to supply to. Um, it definitely shut down. And we are looking at shutdowns that has gone over a year. So we have raised some funds by means of global giving fundraisers. They have some persons who have donated to us directly. And, but I think what we are now, whilst we're thinking about post-COVID, um, I told people for a very long time, I think we'll be living with COVID like the common flu for a very long time to come. And I'm not sure how we look at post-COVID. I think we have to look at building with COVID and beyond. And up to a day like today, as we think about where we are, we have seen numbers actually in some countries increase. So what we have is places like Trinidad that's still on lockdown, um, places like Suriname that's locked down. We have a state of emergency in some of our countries. There are still curfews on. So I'm not sure if there's actually a post yet. But what we also know is as much as people are feeling I've had enough of all those restrictions, for many persons, there's also like, gosh, how am I going to put pants anymore? Do I know how to socialize anymore? How do I meet people? Do I want to be around people? Um, and so you have kind of a multi-layer anxiety kind of happening because for some places that's going back into, and I cannot say normalcy because I think many things have changed and will continue changing. So there's no going back to where we were, but it is certainly looking at how do we move forward with where we are. And what you would see is persons who still don't want to take the bus, persons who still time when they go in the supermarket so there's not too many people. Um, but then on the other end, you have those that are engaging and socializing and they want the drinks and they want the, so again, different people having the different reactions and blowing up right now. And with the big push for persons to get vaccinated, what does that mean? What does that look like? And even for the most educated persons, we know some persons are resistant to vaccines. They are just not, they believe a lot of the theory. Some people still believe up to date, like today, after the multiple deaths of loved ones we have faced, COVID is still not real. And I don't know what to give them or tell them to let them know that this is the real. It may not have affected you as yet, and it may never affect you. Um, but it's real for those who have had to struggle to still be here with us. And it's real for those who have lost loved ones and have not really had a very good closure because of how protocol and processes dictated what your grieving process should be compared to what you are accustomed to. So I think we have a lot to unpack and discuss. And as we go through, I guess we can also see what is similar to that in terms of what's happening in the Caribbean, what's happening in Africa, what's happening in Asia, what's happening in India. Because I think when we review some of this, we would have seen that one of the countries from very earlier on that was actually listed as a leader in this process was a country that doesn't come up on our map too often, even if they're in the global south, north, New Zealand. And I mean, it's an interesting one because of how the leaders of this was actually female-led, considering compared to the bigger countries of the global north that are mostly male-led, and how they were able to actually take control of this lockdown, take the hard decisions, to be able to save the community compared to that of the bigger, powerful countries with more resources. So definitely gives us an opportunity to unpack some of those, and I look forward to even the our participants being able to share a little bit of their experience, but also throw questions at us as we move forward.
Thank you very much, Kenita. Now I'd like us to move to, and I want to ask you guys to hold your questions until towards the end. So I'm just going to move on now to highlight Midnight Punkatissawana, who's from Thailand. He's the Executive Director of APCOM, working in multi-sectoral partnerships with governments, donors, the United Nations, development partners, and most importantly, the community and civil society organizations working on advancing SOGS rights and alleviating HIV in the Asia Pacific region. Midnight is a member of various advisory committees, including the Global Ida Hot Committee, International Advisory Group of Dignity Network, World Health Organization Global PrEP Coalition and Guidelines Development Group for HIV Testing Services, and ASHM's Regional Advisory Group member, leading on key populations of the task force on BBVs, sexual health, and COVID-19. He was honored as Gen T 2020 for his advocacy for the rights of LGBTQ communities in Asia, and also making the Future List 2020 as Thailand Human Rights Advocate. In 2016, Midnight gave the closing plenary statement at a high-level meeting on ending AIDS at the UN General Assembly. Midnight, it's probably about maybe 2 o'clock or 3 o'clock in the morning where Midnight is. So Midnight shared with us a video of his presentation.
สวัสดีครับ everyone. Greetings from Bangkok, Thailand. My name is Midnight. I am the Executive Director of APCOM, a regional organization based in Bangkok. I'm so delighted and humbled to be invited to take part in the LGBTQ plus People of Color Global South Summit. And I hope everyone is staying safe and staying well during this pandemic. I'm also really glad to be sharing experiences from APCOM on this particular topic, our return to society, post-pandemic mental health impact on LGBTQ plus people of color. My presentation will be broken into 3 bits. The first one, I'll give a bit of a background of APCOM. Secondly, I'll share some of our work that we've done in the region. And lastly, I'll share what we have done within the organizations ourselves to tackle mental health within our organization. So I hope you find this useful. APCOM was started in 2007, and we work to improve the health and rights of gay men and other monosex men, as well as LGBTQI people in the Asia Pacific region. Our network covers across 30 countries and with 200 community-based organizations. We're a nonprofit organization with 1 office based in Bangkok, as we work through community organizations in those countries. Our work is primarily focused on HIV, but we also tackle other issues such as sexual health, mental health, drug use, as well as human and legal rights for LGBTQI people. So our work rests upon these 3 pillars: education and innovation, advocacy and research, and lastly, and most importantly, the community engagement and empowerment. So this is where our activities and our events are better connected our community members to partners and stakeholders that will ensure issues from the ground will be able to take some actions at country and regional levels through advocacy, through research that we conduct to create evidence from the ground up, and then ensuring that we use the information to innovate the campaigns on health, rights, and well-being. The Asia Pacific region was the first really region last year that was hit by the pandemic. So in our organization, Bangkok went into lockdown towards the second half of March. And we know that we need to be able to reach the communities and see how they are doing, because different countries were going through different lockdown measures in different times as well. So what we found out was that there isn't a mechanism in our region or in the countries actually that ensures that there is a community-led and community-owned funding for the communities that are working on LGBTQI and HIV issues, as COVID-19 really amplified the need for such mechanism and emergencies to ensure there is resiliency and sustainability of organizations and activists that are working on the ground and doing important work in the region and in the countries. So our staff actually started the Corona Compassion, as you can see here to the left. So which is emergency funding for organizations in Asia Pacific. We're using funding their salaries from our staff to form the first pool before we ask for allies to put funding into that. So in the beginning, this emergency funding went into purchasing PPEs, sanitizers, face masks. And you can see the change now that people, the organizations need is now more on, livelihoods. They want cash to be able to purchase food or food packages. They need shelter. There's all other needs because there is no jobs for community members. They don't have shelters, and they're not able to access the safety nets if the countries have it, because either they're not formally registered in the employments that they're in because they laborers, or they work in formal sector, or because they're criminalized, such as sex workers. They're not able to access kind of these emergency funding, which means they're relying on community-based organizations to be able to provide them with those package of services that's outside what they normally do. So community organizations are now becoming more like humanitarian organizations to give out food packages. And I've also shown here, we did a powwow to get the community to talk directly to allies, to hear about what are the issues and challenges that are being faced because of the outbreak of COVID-19. So we have these regular webinars to ensure that the communities have a voice and there's an outlet for them to be able to speak directly to allies that may be able to help them within their work as well. We have to ensure that we start conversations. So since April last year, we've been gathering stories and started a COVID-19 newsletters. So since April last year, we have now got to 24 issue of the COVID-19. We never realized that it will take this long, and that there'll constantly be stories to talk about. Just to give you an example here, this conversation within Thailand about COVID-19 vaccines for all. How do we do the advocacy to ensure that our communities are not being left behind in the rollout of COVID-19 vaccines? And we have conversations for people in HIV about taking COVID-19 vaccines if they have a chance, because having some protection is better than none. So these are like, the conversation since last year is changing. So we're constantly looking for new stories and how the COVID-19 is impacting different countries in the region and different populations. So we had one on organizations that are working on HIV. We have one on organizations working on LGBTI human rights, from clinics, and also from trans men and LBQ women talking about their own issues. So we are looking at different stories. So since last year, we now have over 100 stories from the communities. And then, and we package them into advocacy materials, and then having partnerships with different organizations to do some other research as well. So I've just put in here an example of the first anniversaries of the our special series on COVID-19 effect. And and then the highlight series about reflecting the current realities faced by our communities that we serve. So that was in partnership with UNAIDS. So the stories also talked about the mental health issues of our communities and organizations. It talks about how they want to be able to respond to their staff to be able to work from home and having the equipment and being able to access the internet. And some have difficulties of the internet access, obviously. And also because they didn't realize there isn't a good safety net that they have internally to be able to respond so quickly to the needs of to their staff when COVID-19 happened last year. And they're also looking to find some ways to be able to respond not just to the needs of our staff, of their own staff, but also to the communities, and then also the expectations from donors. In our region, we don't normally talk about mental health. It's such a taboo. And within our communities, particularly community leaders, don't want to be seen as weak, don't want to be seen as I'm not able to get it together, to be able to lead organizations and to basically be strong. But we have to break down those barriers to be able to talk frankly about our own struggles. So last year we had our APCOM Community Summit, and we had this session on frankly speaking and honest talk with LGBTQI leaders from the region. So we have speakers from Tonga, Sri Lanka, Singapore, Hong Kong, and Taiwan to talk about what are the issues that are experiencing that they're not able to share with their team members, and then what they'd like to see more in our region in terms of being connected to other leaders within our region. And which is why for me this is so important to have this conversation, because we don't have this conversation very much. We are so used to do our own work and ensure that we just do the work, but without really connecting to our leaders and see how everyone is doing, and to share struggles really, and to share also some strategies that people have been using to be able to cope with the different demands, and how they are able to use some of the strategies that they've done either with the community organizations within the organization, or responding as a collective to the donors on the demands that they also have. So I really appreciate the community leaders here, Jolene, Rosanna, Yangfa, Casper, and Heike, for being brave and sharing their experiences and struggles. And I hope that we'll be able to do more of this within our region as well. And then on to the work that we've done internally. The situation is not normal. We have done both online and offline activities to ensure that there is some sense of collectiveness, even though we're going through different waves and going through different protocols within our organization, and also the Thai government's protocols as well. But what we've done in the beginning was to have the daily Zoom check-ins with the staff to check how everyone is doing, just to talk about their feelings. And that has really helped to open up our staff's emotions, talking about how COVID-19 is affecting them, trying to kind of look for information on what's happening around the countries where they're from, because we have expat staff as well, and they've not been able to travel back home. And then we have some photos here from the lunches. So every Friday we have staff joint lunch. So everyone brings something in to share. And this is a time that we really ensure that, we talk about how everyone is doing, and ensuring that, we connect. And food is a good way to connect people. We have monthly team activities since last year. So we call this mental health activities, to get us outside the office and to just, break away from the work mode. So we have done, you can see here, cake making. We went to plant in a park. We went to do some dance in a studio, and also making oil for a massage oil as well. So different activities that we can all do together and just have a laugh, something different outside our normal work. It's also important that we look after our staff in a way that it's about appreciating them. So the photos at the bottom, it's care packages that board members send to our staff, and a little note to say that you know, they've done well, and to say thank you for their hard work and the work that they continue to do despite, you know, their own personal and professional challenges. You know, that is really appreciated. Just to feel like you're being cared for by your organization. The photos at the top, so we had Cheryl Tan from Singapore, who works on mental health, and we did a session together with our staff on breathing exercise, meditation, and we did an exercise on drawing ourselves and, you know, where our pain points are, and then talking about our pain points and what are issues with the pains that we have within our bodies. So that has also helped get staff talking about personal feelings. And yeah, we hope we can do more of this kind of like exercise with our staff as well. And definitely ensuring conversation. You know, we have our staff writing their experiences on COVID-19 on the newsletter also. Here, just to share you some of them. Actually, we are due to have another one again this year to do another reflection from last year on how they've been coping with COVID-19. So this is where they can talk about either professional or personal issues that they write about and they want to share with the wider audience that APCOM sends out the newsletter. So this will form part of our COVID-19 newsletter series, actually. So for me, the mental health is so important. You know, besides being there for each other professionally, we have to be able to support each other mentally as well during this pandemic. At APCOM, you know, we come together through this kind of Zoom meetings, and we have dedicated mental health activities to remind us that we need to recharge ourselves, to put things to perspective and appreciate each other and appreciate what we have. So thank you very much for listening to me, and I hope that what I've shared is helpful and useful to you. And if you need more information from me, please do get in touch with me at midnightp@apcom.org. And thank you so much for allowing me to share my experiences, and hope everyone stays safe and take care. ขอบคุณครับ
Thank you very much, Midnight, for that. And it's clear that Midnight has been doing a lot of work with APCOM in Thailand and with all the other surrounding Southeastern Asian countries. I'll come back and we'll have a conversation with Kenita about some of the things and the work that's also going on in the English-speaking Caribbean. But I think that Kenita has a video she wants to share with us from ECADE. So you have sharing abilities, Kenita, so you can go ahead.
Was that first meeting. Then there was a second meeting in 2017 that further developed on that. And part of this was looking at, everybody was speaking about litigation, but what did litigation look like for the Eastern Caribbean? But we have attempted to ensure that every organization that we are aware of within the Eastern Caribbean, an invite had been sent for membership. The strategy that had been developed looked at pretty much some of the organizations that we had been working with already in the international arena. But part of the strategy for this region was also to look at not just the fact that we wanted litigation and the change of laws. What was the sustainability plan for the organizations in question? And what was some of the community team mobilizing and groundswell that was also needed for additional layers of support, while looking for external funding. And so persons from each of those territories, from these countries, made commitments and decisions that they would come together and make a strategy to look at this. Whilst we had the lawyers discuss unpacking the laws and telling us and guiding us as to which country would have been more likely to have a positive outcome of a decision if that case was to be filed. Coming out of this, we decided that they were going to have strands of the strategy. Our strategy is not just looking at litigation. Litigation is one strand. Education and advocacy is the second strand. And the third strand is actually security, including mental health. And then the fourth strand is communication and campaigns. This is how the Eastern Caribbean strategy has been set up for the country. And so any litigation process that has come up for the region, even if we are not involved in it, in terms of the litigation aspect, we have had to come back to the table and rethink what that means for communication and security. When something happens in one country, the impact is up for us all. Thank you, Antoine, for allowing me to show this. I think it was important simply to look at the strands of work that's taking place and why it's so important to ensure that regardless of the multi-layer approach that you look at to advocacy, mental health, self-care, that type of reflection is always needed and necessary. And I'm happy to hear from Asia community on their focus, not just to the general community, but also to that of the internal process with the staff that is allowing them to also be able to take care of themselves. Because for many organizations, we are so focused on taking care of everybody else, and then that is not necessarily done internally. And I have to say that ECADE has probably followed the very same route in terms of looking at the days off for staff, looking at how we manage in time, looking at our staff retreat and what we're able to do with that in terms of building on each other, with each other, learning from each other. And even as it is Pride Month, we are actually doing well-being teamwork, which is first time ever where we allow the staff to really do at least one workout a week with each other as a team. And that's somewhere between cardio, yoga, and it's going to be mixing up a bit for this month as we look at well-being as a primary focus for ECADE here in St. Lucia.
I'm glad that you talked about that, Kenita, because I am interested in what does, so before we got online this afternoon, you and I were chatting briefly, and you said, you made a comment about returning to normal, but that normal never really existed before the pandemic. So give us an idea of what life was like for particularly LGBT community members before the pandemic, how you experienced or what you saw were their experiences now during the pandemic, and what you see is likely to come up as some of the issues, including what you talked about when you shared about, the anxiety and you know, the fears about socializing and resuming, getting back to a quasi or some kind of normal. What does that look like? So give me a sense of what life was like for some of your community members, how they coped and managed during this pandemic, and from what sense do you get from talking with them, interacting with them? Does it look like for the future whenever this should end?
Right. So what we have seen, and for the experiences that I will share, will actually be across the Eastern Caribbean, primarily, because that's ECADE focus. Although we do some of the further regional work, but we do more of the sub-regional work, which is Antigua, Dominica, Grenada, St. Vincent, St. Kitts, Barbados, St. Croix, St. Martin, and I would tell you, Antoine, when this pandemic hit, we actually hosted an end of a project we had here in St. Lucia. We actually had people in country with our partner Kaleidoscope Trust. And we were doing this project called Equality Justice Alliance. So some of the resources that you just saw, like the legal gap analysis on mental health, understanding abortion, restrictions, looking at stigma and discrimination across the countries, and even a manual we developed on diversity and inclusion, a training manual that can be used within NGOs as well as NGOs using it with private sector to kind of mobilize and boost our inclusion in the workforce. All of those things were actually created between 2019 2020. And so when we had the great idea that we're going to be coming together and launch those things, all of a sudden we had to be rethinking what that looks like in terms of our work. So that meeting in March, the first week in March actually, was the last regional get together that we had, which was inclusive of a pre-board meeting for ECADE in person. And from then, we had to rethink everything, the entire strategy. Every organization had to rethink their strategy. Organizations which had project funding that was primarily to animators or outreach personnel now couldn't do outreach and was now fumbling trying to figure out how do we meet those numbers? How do we reach? And I have to say, the one thing that I am thankful for is that the donors that we had at the time actually reached out to indicate or to find out how can they be more useful, but also gave us an option to reallocate funds to help the member organizations that we were working with. So immediately we saw people now looking at not having the safe spaces, funds for the safe spaces. They couldn't pay their staff because of how the projects were written in the contracts. The mobilizing that needed to be done. So we found ourselves actually reaching out to organizations, advising and helping and strategizing as to persons who are HIV positive, making sure that they have meds for the whatever period, because we do not know how long those lockdowns or changes would be for, making sure people had access to condoms. And then you had persons who couldn't take the condoms home because it was creating other complications. You had persons who just invested money in businesses, and with this pandemic, shutting things down really put them in a deep hole. So the money they did have, they used it, and now they don't have to take care of themselves. You had people saying they need help for shelter. And I think the situation that we had, and we still have, was exacerbated to a point where it was so glaring. You couldn't say that you don't know what the situation is. Because COVID, even if we were dealing with situations of the employment, of the shelter, of some of the stigma and discrimination, COVID just says, for all of you who pretended y'all did not know what it is, here it is, a slap in the face. Left, right, and center, it was there. The women organizations that are part of ECADE's group was reaching out because, again, both domestic violence against women and children escalated. The irritation of being locked down was being taken out in all different ways. LGBT folks who would say, okay, parents gone to work, siblings not there, I can be okay, now was in a place with people who did not understand them, who they had to create mechanisms to be able to be themselves. And sorry, it's not even a matter of being themselves. They created mechanisms to exist because in many situations, they were not being themselves. They had to redesign themselves to coexist in situations. We have persons who have been homeless. COVID made it difficult for them to be in any spaces. And finding a place that they can be was difficult during that time. Again, looking at protocols and not shifting house to house, transmission and what that looks like. When we started this fundraiser, first of all, we got the board to approve a transfer, a redirection of funds to do some of the initial reach out. We gave almost every organization $500 to $1,000 to at least start doing care packages. When Outright launched the emergency support, we supported organizations to apply for that, to get some funds to do some work on the ground. And then we additionally launched the Global Giving fundraiser again, and we have just been paying for one thing to another. And all of the 9 countries that we work in, at some point between April of 2020 to present, we have given support in one way or another. So when we think about where people are, a lot of activists, and I'll start in-house, a lot of staff of organizations are screened out. A lot of activists are burning out because although people felt like, oh, countries shut down and so on and so forth, activists have had to step up twice the amount, almost 24/7. It didn't feel like they had a difference between Monday and Monday. And so you're carrying all of this. And I know sometimes we say we want to be able to talk and debrief, but they really I would tell you 2020, did not even, I don't even think that there was an opportunity to debrief much, simply because all the organizations that we work with locally, regionally, and internationally, everybody had to pause and everybody was rethinking how should we work. And everybody was sending twice as many emails because they're not traveling, booking twice as many meetings because they're not thinking about the heavy schedules. So sometimes you did not even have a bio break because you are jumping from one meeting to another, which was even worse because people are not thinking that we are actually seated in one location more than if you had to jump on a train, jump in a car, take the steps. At least you had that little breathing room and a little exercise. But within the last year, we did more sitting on our butts or laying on a bed than we have ever done in many of our lives. And so some of these things actually took a toll because you had some activists who had been more active than others. Maybe hardly spent 2 days in country, could not even remember the holidays in their country because they were never quite around. And those things kind of move, but what did it do for the community? That's the activists. Community now trying to figure out. You have persons who are paid on a daily basis, and that's those persons who are trying to hustle. They're gonna hustle to cut your yard, to clean a place for you, to do whatever. Those persons can leave their house as they want, and therefore income is not necessarily coming in or readily coming in. You have persons who are being paid on a weekly basis, a fortnightly basis, and a monthly basis. Some of these salaries cut. How did our national insurance schemes, which you have been paying, take take was processed or take into action? Some of those things took a very long time to actually put in processes that looked reasonable for people. And did it cover everybody? No. Because if you are self-employed, whether you're doing your little selling by the road or you had your little shop or whatever the case is, if you are not contributing to the NIC scheme, then it means that there was nothing there for you and there was no fallback for you. And so I think it really showed people who was who. It showed the economic inequality really in many of the countries. And I think what it also did was, especially for the Eastern Caribbean, it challenged the businesses to also rethink how they do business. Because a lot of our processes were not online systems. You couldn't shop online and get it delivered. So some of those processes had to be rethinking, especially when you go to the supermarket and you're going to have a line that's going to take you from here, from New York to New Jersey, and you don't know what time you're going to get in, yet you have a curfew that you have to think of, and how many different places do you need to go that may still have a line just the same. So I think that COVID um, unpacked what was happening, but it showed us more clearly what was happening. And the work that we did to reach members, and everything was online. So even the membership, along with the organizations, started feeling this like, not another Zoom, not another webinar, not another. And when we did the actual survey, we did a survey that was done through Equals Barbados, with the Being LGBT in the Caribbean program, which is funded by UNDP, and we're able to do a survey that surveyed Guyana, Barbados, Grenada, and St. Lucia. That was the pilot, and it actually, from what I am saying to you, there are actually statistics to tell you about the employment, the feeling, where people were at that point in time. And, the reality was real. Following that, Kaleidoscope Trust also did a survey across the Commonwealth. And so that would tell you, which is mostly our people in the global South, now telling you where there is statistics that would show where Africa is, where Asia is, where Pacific is, where Caribbean is. And they were able to mobilize some money from the UK government late last year, which were able to do some programs this year. And so they have supported some work again in Africa, Pacific, and the Caribbean this year. So really, we have been, I feel like we officially need a month vacation. I don't know when we'll take it yet, but we have been going, feeling like round the clock for this, because again, we are trying to respond to everybody and trying to ensure that we are meeting the needs of the community consistently.
Thanks, Kenita. So here's another question too, and I heard a bit of this when in Midnight's video, and you mentioned a little bit about it as well. What parallels do you see between the COVID pandemic and HIV? Because HIV is still a continuing pandemic.
Yes.
So
yes.
what parallels do you see, or are you seeing and hearing about in the English-speaking Caribbean, in the Eastern Caribbean?
I think the only thing between HIV and COVID that's different is One has more of a human responsibility in terms of action, and the other one says, once you're in the wrong place at the right time, I'm going to get you. Because COVID does that, unlike HIV, where you may see that you have to partake in certain activities to get it. COVID is almost like, the only thing they did not say COVID was airborne. So when we look at how, I think one of the things that would be majorly different is the numbers, how quickly that flew up. The death toll across the countries. HIV came to us in I want to say spasms, because there's a blow up here, a blow up here, a blow up here. But COVID just seemed to have done ... So again, I think one of the things that it really brought to light, and I mean, in the beginning, they first said COVID was a rich man's disease. That was the talk in the region. And I wanted to know why. And they said, well, actually, it's mostly the rich people that could take a flight. And it's the flights that's bringing the COVID. So if you had to really track how the COVID got spread so quickly, it's because it says we had a good set of movements flying. And I was like, oh, interesting. Because I didn't think half of us who fly was rich. But again, just thinking about who has money to afford a ticket. What we also saw is understanding and thinking through where people were in terms of whether they saw themselves responsible for keeping themselves safe, or whether it was a government responsibility. And I think we can run that against the HIV again. What we also saw, Antoine, was because of our islands being small, the HIV units, the National AIDS Secretariats in all our countries were actually the ones trained and responsible for COVID response. So for a quick hot minute, it felt like HIV was given a backstep to the COVID response because it's the same personnel. And in terms of testing, in terms of monitoring, and what we saw was, I kind of felt like across our countries, and we're just discussing it again, whether any further damage has been done to the HIV epidemic. And is there a spike we're gonna expect closer to the lowering of the COVID situation and people start testing again? Is that going to spike our numbers? Because people have had time to be locked in home, not necessarily accessing birth controls, not necessarily accessing condoms and necessary drugs. And if the adherence of those who are positive have sunk, that line has sunk, we know they have increased numbers in terms of domestic violence and child abuse, does that also spike the numbers? Because usually persons indulging in the violence of rape does not necessarily think about condomizing. Within the LGBT community itself, even prior to COVID, what we saw was actually a spike in the, there was already a spike in HIV new cases, as well as syphilis among our gay men. There was, and that was already a concern. So right now, it's not post-COVID, but I think it's getting understanding that reopening of services, what would we be seeing when we start looking at HIV more closely? And can we actually divide the time to look at the two parallel? because I think that we are going to see so many things similar when we think about the 1980s and we look at 2021, 2020 into 2021.
Yeah, that is actually quite interesting because there have been discussions here in New York about those similarities, and that there's talk about an expectation of a rise in HIV numbers and infections, because one of the things that we saw over the last year because of the pandemic was an increase in alcohol and substance use. We also saw that there was an increase in domestic and intimate partner violence, as well as sexual abuse, not just of adults, but of boys and girls. But what we also saw is that, particularly in the gay community, they were still, even though we were on lockdown, people were still accessing the hookup apps, and they were still sneaking and going to people's homes and engaging in sexual behavior without using any forms of protection or whatever the case might be. And so there's now an increase also in both chlamydia, gonorrhea, and syphilis. And so that on top of, a COVID pandemic. So here is the other thing that I'm interested in learning is that now that we talk about moving, let's say we get to the point where things start opening back up. How do our community members, what is going on with our community members who are still struggling with residual COVID, who may have had COVID, recovered from it, but they're still suffering some lethargy, some tiredness, some fatigue, some additional pain somewhere. Something is going on, so there's problems with memory, there's problems with increased anxiety, with potential for descending into depression. What are some of the things that you're hearing from people who have experienced COVID and have recovered from the physical symptoms of it?
Well, I have not had many conversations with persons who were willing to speak openly about having COVID. Again, you'd understand that in small communities, the stigma and discrimination is still pretty high. As a matter of fact, the Ministry of Health had to put out this ad, even for our nurses, Antoine, who are actually taking care of patients. People would run away from them or as soon as they come around, pull themselves like the nurses are walking around with COVID on them or something, regardless of the measures. So we find that the conversations openly about who have had COVID or not is not necessarily happening as we think it should be. But on one, occasionally, when you get persons to talk about it, I think what you have is the behavior, again, relating it to HIV. That's what it reminded me of. Because if somebody just hear, they don't ask you, they're not your doctor, they didn't see your tests, but if they just heard you may have HIV, if you want a cinema to yourself, is just say somebody HIV and you see nobody want to be around anymore. That kind of behavior. And it's the same thing that was happening to persons who had COVID. Now it's less, but in the beginning, it was very much like that. The only time St. Lucia have ever seen a country truly shut down was actually when the government decided that there would be no sales of alcohol for almost a week or 2 weeks. And I mean, if we think about it, it's probably the only time in our history any church has ever been completely closed. It's during the COVID, unless your country, different, but state of emergency and lockdowns happen at different stages in the Caribbean. So, I think even right now, Suriname, and I see we have Lucien Govad here. is probably having, I think people can only get out of their house on a Monday, Wednesday, and Friday to go to the supermarket because they are still experiencing high levels of incidence of COVID, almost 100 to 200 plus cases a day. So now Suriname is in extreme situation. Trinidad shut down. That airport hasn't been open for a while, but the cases in country still going up. St. Kitts, after being 0 cases for a number of months, something slipped up. They now have community spread.
And I see the same
Again,
thing is happening in Guyana.
there you go. So,
Guyana is
and I mean, they're
rising.
talking about the second and third wave for some countries. So I think it's important for us to think about how these things are, when you think you are coming out of it and people are thinking, hey, we're going to be opening countries and flights are going to be resuming and work. And then when those things happen, it sends us back to March, April of last year, and sometimes even with worse protocols. The other thing that we saw and we had to monitor was how the governments were implementing policy during that period, because they also had policy that had to have been challenged that the government couldn't implement because it was discriminatory. And so we have had to help the community monitor policy, monitor, do the trainings, still fundraise. And at the end of the day, we then had to think about how can we also take care of ourselves. So for me personally, I can share with you that I almost feel like I'm a gym freak now because every day I need to work out because it's the one space that I can let go of all the advocacy and just think about me. And that's 1 hour a day every morning for now. Well, Monday to Friday, weekends are no. And but I'm advising everybody to get at least one thing they can do that takes their mind away from the work at any point in time to allow themselves to breathe, allow themselves just that downtime where they are not processing, they are not strategizing, they are not thinking. Even if it means watch a series on Netflix, on Amazon Prime, something, just get yourself away from advocacy, away from the work. Um, the work is important, but if you are not in a good place to do the work, then it means that you might be doing harm and not doing good. So also think about how you can do good and be good to you whilst you are trying to make sure you do good to the community that you have committed to serving.
Thank you very much again, Kenita, because I was interested in what you're talking about in terms of the parallel with stigma, the stigma surrounding COVID, similar to the stigma surrounding HIV. And so one of the things that we were talking about here in New York is the possibility that that same kind of monster would raise its head in terms of looking at the way that we stigmatize and discriminate and shame people with COVID is the same thing that was done and still is done to people with HIV. And so, parallels are there, and it's the question of how we as humans respond, and more so how they become isolating in small communities. And I'm just interested that even with all that you have going on there in the Caribbean, then you had the volcano in St. Vincent.
Yes.
So have you heard, is anything coming out of St. Vincent? How are our community members surviving and managing with a pandemic, with lockdown, and on top of it, you have all this pumice stone and all over the place?
No, but Antoine, you actually missed this because with COVID, so with HIV, with COVID, with lockdown, with a dengue epidemic,
They have a dengue epidemic too?
they had one too, which also took lives. Then the eruption of the volcano. Then after the volcano erupted, they got rain that brought flood into the country because of the ash and how it does.
Yeah.
Flood up, landslide, and all kind of thing happen. Man, I don't listen. This is true resilience happening in St. Vincent. We have been working with Vinci Chap. We have been working with Red Root. So Vinci Chap is the HIV LGBT organization. Red Root is the women and girls organization focused on teenage mothers. And we have been, and that is the next fundraiser that we actually launched. We have actually had one of our funders allowed us to transfer funds again, where we were able to buy masks, respond with water, almost like within the first 2 weeks of this happening. And with the fundraiser, now things are less problematic. We can actually send some funds to them where they can actually buy stuff on the ground. And Anton, I also need to thank you because you were one of our donors from your organizations to say, let me make sure I do a donation to this because this is important. But even at this point, as the people are trying to return from this eruption, like persons who were in the red zone have pretty much lost their houses. So it's a whole rebuilding happening, reorganizing of communities. And, you know, your persons who are in the, and you know what, Antoinette brought up a thing. Whilst this volcano was erupting, I know it's safety first, but you know, some of the countries which were willing to take in people, but the conditionality of having to be vaccinated first came on the table during a volcanic eruption.
But they didn't have
So
but we didn't have a viable vaccine then.
it was kind of there already, but then the question is, how much did we have access to at the time? Because we know even if they're supposed to have a body which was negotiating the vaccines, a lot of the global north not global north countries went directly to the manufacturers and said they kind of obtained a lot of the vaccines that global south was struggling to get. So the numbers that we were getting was not sufficient to really, and I have to admit, there was a slow uptake in vaccine. As you know, there's the whole 5G talk about being chipped and being monitored and being, and you know, this has really damaged. This is one of the biggest things that has damaged the genuinity of this vaccine on saving people's
Yeah.
lives. And what people don't understand is this vaccine may not stop you from getting COVID, but it can actually help reduce the death sentence of COVID on some people.
No, I
And
agree.
so it's really a difficult thing. I have felt like sometimes it's better not to have the vaccine conversation with anybody because I'm not trying to tell people what they should and shouldn't do, but I do ask people to examine common sense in terms of loving yourself and loving the people that you say you love, and how are we protecting them in, you know, whether you have a job in the hotel, you have a job in the police, you just go to town, follow protocol so that we keep each other safe. Even if you decide
Yeah.
not to take the vaccine, follow protocol. But you cannot not want to take the vaccine and don't mask up, don't sanitize sufficiently, and all of them things. And then it just continuously putting other people at risk, especially those who are carriers that may not even know they are carriers because they have no side effects.
I just got there's a question here. Have you found any helpful tools in building community confidence in the vaccination? The same person is saying that I like the angle of loving yourself and loving your community. So they're asking, have you found any helpful tools in building communities' confidence in the vaccine? And just to respond briefly to that in a sense as well, is that here in New York, I am part of the Community Advisory Board with the City Department of Health on both test and trace and the vaccine. And one of the things that we have been pushing for is for clear, consistent, and concise messaging. And we just also added another C, which is culturally appropriate. So the
Yes.
messaging that we have been talking about in New York City has been mixed and coming from different sources, and you're questioning the reliability. And so there's been an issue about conciseness and consistency. And so that's one of the things we've been pushing. And it has been a difficult task to get city government to get on board with at least those 4 C's: clear, concise, consistent, and culturally appropriate. But going back to the question that the person just asked, have you found any helpful tools in building communities' confidence in the vaccination?
I think one of the things that many countries have done is try to use community leaders as an influence. You know, let them take the picture when they're doing it and put up. I think one of the things that we are combating, though, is this is one of those times where you understand what is access to information. And when we think about the internet, everyone has access to the internet, good or bad information. And we understand what might actually take more of an audience based on which campaign, directly or indirectly, gets the most shares. Now, things that are not necessarily right get more shares because they put it in a funny form or whatever and say, and I feel that this is what we're really combating. So when we think about it, is it a case where what your ministry or government is saying gets to more of your citizens? Or is the stuff that is being sent around on WhatsApp, whether on statuses or through mass sharing, getting more of the attention? And I think this is the thing. The misinformation is so wide that I don't think in either one of the countries they have had sufficient I think buy-in of the community themselves, because even within the HIV positive persons, even them, we had a lot of reluctance that taking this vaccine, they will get the blood clots and they have underlying issues and it's going to complicate it. And like, no, it's not. Where did you get that from? You know, and even for one or two community leaders who actually took it and said, no, I'm fine, here I am. And then they were blasted that they were trying to force people to do things against their will instead of understanding there's just a sharing of information so that you can make an informed decision. So as many persons would have said, they would only take it if they have to. They will take it if it becomes mandatory. But we also know if governments try to make this mandatory, it's also an illegal process. Unless it really becomes a public health issue that they may pass an SI, but that SI can be challenged because it would mean that you're forcing persons against their will. So we have to help people understand how this narrative can be changed. What is it really? And I think one of the things, Antoine, that has really been confusing is that when doctors come out, they don't really say what they have the doctorate in, but they put the doctor in front of the name and they speak, and people believe without really understanding, is this a medical doctor, or is this a doctor of geography, or this is a doctor of literature, and what's the expertise that this person really bring to the table? And I think that's one of the things that's also confusing in terms of who the messengers are and what's the message that's being delivered. So I have not seen an effective, efficient tool to move the confidence of the vaccine. I think it also has to do with which vaccine that is available here and what people have heard about it and what they think it is and what they think it will do. So again, all those kind of interpretations are hindering us.
Thank you very much, Kenita. And this is really interesting. And what I think is fascinating about about what you're saying is that nothing of what you're saying is different than what we are experiencing here in New York. And I don't, one of the things that I have a problem with is the same doctorate thing, because you know a medical doctor will use MD or a DR, but everybody who may have a PhD or a PsyD or some other or an ED will just put a doctor DR in front of the name, and they start representing as if they're a doctor and people start listening to them. But that's a whole nother conversation, because people then get upset when you comment on how they are using the word doctor
Yes,
to be addressed.
yes,
So
that's
thank you
again
very
it.
much. Yeah, so thank you
I
very
think
much again,
I think
Kenita. So
uh, Antoine, just one last thing, because I
yeah,
think people should know, as we listening, we have had these pandemics, but there's one area that we have had every year and it's continuous. And right now we're in it. So as you know, they, especially Caribbean and Pacific islands, deal with a lot of typhoons and hurricanes during a certain period of the year. Whether it is flooding, whether it is strong storms, weather systems that just impact the islands. And on top of everything else, last year wasn't too bad gracefully, but 2021, we are now in hurricane season again. And according to projections, is going to be a very busy year. As a matter of fact, earlier this year, even before the hurricane season opened, there was already a storm close in the region. It didn't turn into anything, but just saying that the weather system, the warm water has invited a lot of activity, and we don't know what that is going to do. Which country is going to be more at risk? All we have to do is continue being observant. And I know the US know what it's like to be hit by Sandy. Never thought it would get that far inland, but we have no idea what's coming at us, which global south region might feel, whether it be a hurricane, whether it be an earthquake, or whatever it is. But climate change is still very much a big issue, and something that we should also take into consideration when we're thinking about the anxieties, when we're thinking about mental health, where people are, because it's also like HIV pandemic, COVID, dengue, volcanic eruptions. And even if St. Lucia was not, St. Lucia still got the asteroid. Barbados was loaded. So countries got affected by this volcanic eruption that happened in St. Vincent, but St. Vincent definitely got the brim of it. And now we are preparing for a hurricane season, not 100% sure what to expect. So
yeah,
just want
that
to put
is
it on the radars.
no. But that also is also pretty important, because it means being preparing now for that, because that is actually going to come up in the next couple of weeks or next couple of months. So it's about being prepared. So thank you very much again, Kenita, for sharing and talking with us about COVID for our community members in the English speaking Caribbean, in the Eastern Caribbean. And then now, picking this up again next week, we continue with the Global South Summit, and we will have on June 18th, we'll have we'll have one program from Africa, one segment from South Africa, representing with representatives from Transition, a transgender organization in South Africa, and the Zimbabwe Rainbow Community from Zimbabwe. And then we've got from West Africa in Nigeria, we've got Creme de la Creme House of Fame Foundation and Instab Niger in Nigeria. Coming up the following week, on the 23rd, we've got Southeast Asia with representatives from APCOM, KIAS, Surakita, Micro Rainbow International Foundation, and Baby Lanes in the Southeast Asia. And then on the 24th, we've got India, representatives from India on the 24th. That is actually a typo on the flyer there. It says 28, it should be 24th. But then coming up on the 28th, we've got representatives from the Middle East and North Africa region talking about visibility, deconstruct myths, lies, and prejudices, where one day they'll be talking about art as visibility, and for the second day, they'll be talking about writing as an act of visibility. And then we close on June 30th with our closing. So we want to thank you guys and thank you all very much for joining us this evening. This went much better than I thought it would have been. Thanks to Kenita for stepping in and assisting with making this happen. And thank you guys, all of you, for tuning in, for joining us. I saw that somebody asked a question about, is it possible to share or drop a link to this flyer in the chat? We are working on finalizing the website, but we will send the flyer out to all those who registered. Yes, and you can also get it on our Facebook page. Thanks, Kenita. All right, so thank you all very much. Let me stop the live stream and stop the recording.